dementia gave a very high impact onto our society. I think not only in Hungary, but also in Japan as well. Average age is getting higher and higher at that fastest speed. So our society is getting older and older. Now the elderly people are increasing, and of course the number of dementia patients are increasing. It decreases the social ability to produce something, of course, but the problem of the care of these patients are also becoming very important, because the care for the dementia patients gave a very, very heavy burden on their families. So that means that the dementia has multiple negative factors on the society. There are various kinds of methods to diagnose dementia. Of course, the clinical diagnosis is a very important one. But when the clinical symptoms become manifest, so to speak, it's a little bit too late, because the patients has some limitation on what they think about their future, for example. Yes. So it is very important to predict as early as possible. We have been developing a new diagnostic system using the positron emission tomography, using the specific radio tracers binding to the beta amyloid plaque in the brain of Alzheimer's disease patients. So we have been, to some extent, succeeded in getting the positron emission tomography images that gives a contrast between the elderly, healthy people and the Alzheimer's disease patients, but also the in between, the patients with a symptom of a mild cognitive impairment. So in future, if we have the PET image of a MCI patient, maybe we could make a kind of prediction if the certain guy is going to be Alzheimer's disease in 5 years, or maybe not. One important issue for using the PET tracers for amyloid imaging is early diagnosis or early detection of the possible converter from mild cognitive impairment to Alzheimer's disease. But another important factor would be to use the PET tracer for the monitoring of the therapy effect. Because when MCI patients start receiving the oral tablets or a patch for bettering the cognitive disorders, maybe these drugs might affect the patient's brain. But if we use PET tracers efficiently or effectively, we could compare the PET images before and after the treatment. If we find any decrease in the binding of the PET tracers in the brain of these patients, we might think that the therapeutic option was very successful and can continue further. One big project of our research institute is amyloid imaging tracers using with PET. But another one is a project for imaging the activity of acetylcholinesterase in the brain of patients. We have our original tracer that is carbon-11 labeled donepezil. This is exactly having the same chemical structure to the donepezil. When doctors are using for the Alzheimer's disease patients. This can be used for the various purposes, I think. For instance, we are thinking about carbon-11 labeled donepezil could be used for the prediction of therapy effectiveness for these patients, for instance. I think the donepezil PET can be used to predict which patients should continue the drug therapy or maybe should change into another agent for the therapeutics. There are various kinds of tracers for amyloid imaging has been introduced all over the world. And at Tohoku University, we have originally developed two radio tracers. One is a carbon-11 labeled BF227. This is used for our clinical studies for the imaging of the Alzheimer's disease and also the MCI patients, as well as other neurological disorders like prion disease, also the multiple system atrophy, and so on. The other is a fluorine-labeled compound called F18 FACT. That is a longer half-life of nearly 2 hours. So this kind of fluorinated compound for amyloid imaging will be very popular in near future because it's quite easy to increase the number of patients scanned after one radio production. And also it is quite easy to transport the radio synthesized tracers from one institute to other surrounding hospitals. So the approximate length of half-life of 2 hours, exactly 110 minutes, is quite long enough to transport the product to other facilities.